Government efforts at containing the pangs of the corona pandemic have been thwarted by patients who surreptitiously abscond from hospitals or who are deliberately they decide to hide their status from health officials and mingle into the community. The Guild of Employers of Cameroon, GICAM, raises a red alert as to the fate of business in Cameroon under the all devastating pangs of the killer virus, the COVID-19. The handwriting is getting clearer on the wall as all the signs on the ground are indicating that work on the long-awaited Bolova-Krivi Road will soon begin, much to the glory of the local residents. Those are our lead stories. Hello and welcome to the program. I am Ben Meno Pufong. The whiplash of the COVID-19 pandemic is stronger today than the last months, with the Ministry of Public Health confirming over 1,500 cases, nearly 2,000 to say the least. The ministry reports close to 700 recoveries and almost 800 people currently sickened by the disease. Of this number, 207 are hospitalized. So where are the rest of the sick people? Reports say many people shy away from the hospitals and would prefer to struggle with the disease at home, a behavior which health experts have blamed, that's blamed all the deaths, and they say they're confirming all the deaths, the majority of the 53 deaths having happened from people's homes. We now have these details with Beatrice Losamba, who reports about this behavior that needs to be changed for the COVID fight to take full speed and make more sense in the country.
There might be more COVID-19 patients in our neighborhoods than we can imagine. A neighbor known to show signs of coronavirus infection vehemently refuses to go to the hospital.
I have a neighbor who has been in close contact with someone I know tested positive for coronavirus. She has been coughing and sneezing. She has openly refused to go for screening for fear of being quarantined.
Many such stories are reported every day. The Minister of Public Health tweeted Sunday 768 people currently sick, 207 of them only are hospitalized. The rest choose to handle the disease at home. Now, health experts working to quell the COVID-19 pandemic have been thrown into confusion about this behavior termed deadly.
Stigmatization is part of the reason. When someone thinks he will be stigmatized, he will avoid going to the hospital. And it is necessary to point here that there is need to support each other during this pandemic because we all are at risk.
The disease burden, experts confirm, is bigger than one man alone can carry. It needs specialist attention.
The patient's case might worsen, and he may have severe symptoms like coughing, respiratory difficulties, and may have respiratory distress at home. He might contaminate the community as well, beginning with his family. There are cases of couples and families infected like this.
Moreover, this stands the risk of frustrating government efforts to stop the spread of the disease. The number of infections and deaths increase each day, mostly related to patients who have stubbornly stayed home. Government is calling on individuals to report such cases, which must be tracked down if the COVID-19 fight must take full speed.
One of the rapid intervention measures put in place by the government to save the lives of coronavirus patients is the ambulance services. These are workers charged with the responsibility of picking up patients tested positive with COVID-19 around the neighborhoods and transferring them to different emergency centers for treatment. Our reporter Alice Mbe followed a rapid intervention team from the Central Regional Delegation of Public Health who worked together with the ambulance services and put together the following story.
When officials at the Regional Delegation for Health in the Central Region receive any phone call from patients indicating symptoms of the COVID-19, an online consultation is done. If it is a suspected case, A rapid intervention team of 5 health personnel made up of an epidemiologist, a lab technician, a wash specialist, a communicator, and a cleaner is deployed to the site. The environment is first of all disinfected to ensure it is free from COVID-19 virus. The team then gets set to face the suspected case. The patient sample is collected and sent to the Central Pasteur in Yaoundé for testing. If the result is positive, an ambulance is sent to pick up the patient, who will be driven to any of the emergency units for treatment. The ambulance services depend on the number of positive cases detected per day. They work in collaboration with the medical team.
Health Pass COVID commuter testing, a mobile application developed by Julie Laure Mason, has been declared best ICT solution at the 2020 edition of Barcamp Cameroon. The hackathon ran for 3 days online under the theme Hack the COVID-19 Crisis for Cameroon, with 78 young startups who participated in the competition from across the 10 regions and from abroad. The ceremony was presided over by the Minister of Post and Telecommunications, Minette Libom Lilikeng, via a video conference. Yoti Kaleli Sange reports.
ICT skills avail in fighting the coronavirus in Cameroon. The 78 youngsters who participated in the hackathon at the 2020 edition of Barcamp Cameroon have come through with digital solutions. But 3 of the projects stand out. They include Stay Out Safe, Virtual Doctor, and the overall best Health Pass COVID-19 commuter testing, a mobile application developed by Julie Laure Mason.
This solution is built for helping everybody to know where is the safe place. Maybe we have in some place of the town, maybe in Yaoundé, where there is a lot of COVID-19 patients, and you could use another way for transportation.
The jury's choice was based on the project potential, team profile, type of innovation, and hackathon recommendations.
I'm very happy and very proud of those young people at the end of this competition. We are going to accompany those young project owners to be in contact with the Minister of Health, because 80% of those projects are in link with COVID-19. So even after that, we need to give them a technical support so that they can also have other partners, even international, to finance.
The over 200 participants at the 2020 online edition of Barcamp Cameroon remain committed to provide more solutions to help the country overcome the COVID-19 pandemic.
Heads of communication units in the various government ministries were meeting in Yaoundé today to review and overhaul their communication strategies in the propagation of the government measures to slow the spread of COVID-19 in the country. After elaborate exchanges with WHO officials, with the Secretary General in the Ministry of Communication as the moderator, the communicators agreed on the need to harmonize their strategies and put an end to the current communicative noise that is raping the government measures across media outfits in the country. Beatrice Ngum reports.
They are the relay to the outer world and their staff within their respective administrations, no doubt. But in this time of COVID, much more is expected of them. They have to reinforce internal communication so as to promote preventive measures among staff, but also to speak with a common voice on government actions.
It gives room for all the communication units to speak one and the same language, and that can now be better understood by the population. Imagine a situation where the facts and figures, as far as the pandemic is concerned, are not the same. So it goes a long way to give credibility to whatever from henceforth will come out as information.
The merit of the workshop organized by the Ministry of Communication and the WHO has been recognized, with the WHO promising to do even more.
If our language is not harmonized, the community will no longer believe the COVID information we give them. hence the necessity to train those who relay this information to the community so they speak a common language, and by so doing, the population will be receptive and adopt less risky behavior.
With their capacities reinforced on the fight against COVID-19, it is also hoped that the fight against the pandemic will take a leap forward in their respective ministries.
We now open our running series on small and medium-sized enterprises that are not accessing bank loans due to the effects of the COVID-19. With measures to check the spread of the COVID-19 still being enforced nationwide, SMEs have begun feeling the impact on their activities as many of their loan requests from banks have been turned down. While credit institutions explain that the public health crisis has brought about uncertainty in the banking system, promoters of the small and medium-sized enterprises argue that the business cannot survive without the much-needed financial resources. Clarice Array-Takam went finding out the reasons behind the reluctance of banks to grant loans and put together the following report.
Prudential regulations enforced by commercial banks in moments of crisis. This is the rule whose consequences loan applicants have been suffering since the coronavirus struck. The reality for private sector workers and enterprises is an uneasy one.
We have now with our bank pressure due to the fact that we are not able to sell what we have produced. And you see, it is very difficult to continue our production without have a kind of help.
Containing the spread of COVID-19 has put a strain on the banking system, with banks insisting that they have been pressured to tighten loan conditions as a result. Restructuring or rescheduling loans granted to sectors hit by the pandemic has its raison d'être on risk assessment.
If you consider that the credit is a kind of advance of the future revenue of enterprises, banks are not efficiently covered because of the lack of the revenue of enterprises in the next few months or few years. So we are in a period of uncertainty, so that nobody now can take risk as investor or banker.
Will the bank's money be refunded or not? Is there a continuity plan in the enterprise to ensure that a loan will be repaid no matter what happens? This risk assessment has been in place since the start of the pandemic.
Amongst the proposals made by the central bank to enable economies of the sub-region better deal with the impact of COVID-19 is that of injecting 500 billion CFA francs into the banking system to fund economic and other activities. SMEs are hoping they will not be left in the cold once this becomes effective.
And the cold is threatening to be longer as the Cameroon Employers Union GCAM is equally expressing worries on the impact of the COVID-19 pandemic on economic output, especially of companies in Cameroon. This follows the results of a 20-page survey of companies on the business situation following the outbreak of the disease in Cameroon. Veronica Benyala tells us more from Douala.
According to the study, 85% of enterprises believe that their turnover is directly affected by the coronavirus outbreak. This trend applies to both large enterprises and SMEs. In this melee, 92% are production units, with 52% being SMEs. However, the most affected sectors are hotels, catering, tourism, events, transport, crafts, commerce, and distribution. Many have so far opted to dismiss workers, but to take transitional safeguard measures such as partial leave, shortening working hours, or even technical unemployment. 43% has recourse to partial unemployment, and 53% has announced that they would not be able to last more than 3 months if the crisis continued and without the expected support measures from government. GCAM reiterates its confidence in government's response to the issues facing the country. They are vehemently calling on government to take urgent and impactful measures that will measure up with the present situation in order to prevent the emergence of an even more difficult economic and social crisis within the context of this health crisis.
The Yaoundé Sibalène International Airport, for one, has largely equally been suffering from the effects of the COVID-19 scare, with activities disrupted. An airport that has never been reputed for being a very busy one is completely dead silent. Our reporter Luma Slim Davis was at that airport, and in the following report says the absence of flights and related activities at the airport has affected seriously revenue of the Cameroon Aviation Authority. Luma.
The Yaoundé Sibalène International Airport is virtually on recess as the coronavirus scare rages on. The runway tarmac could be said to have gone into deep slumber with the banning of flights into and out of Cameroon, and the financial drop in revenue is enormous.
The borders are closed and the airport non-open only for repatriation flights and cargo airlines only. And this represents less than 20% maximum of our activities every day. And our personnel, most of them have been put on annual leave, pre-annual leave. It's not the normal period because there is no more activities.
The embarkment hall is virtually empty. No planes landing or taking off, no passenger movements, no activities, and consequently no luggage has been trolleyed from departure halls into waiting aircrafts and from aircrafts to arrival hall.
We are trying to keep the airports operational. In the airport, 90% of personnel are operational. We have only 10% that are purely administrative. So half of the administrative one have been put on annual leave, and the operational one, 70% of them.
As planes of the World Food Programme are parked quietly at a corner, airport authorities are taking advantage of the low aviation activities to carry out some repairs on the tarmac.
And the Secretary of State in charge of pandemics and the control of epidemics in the Ministry of Public Health, Halim Hayatu, is on a working visit in the Adamawa region to check and evaluate the region's preparedness in responding to the measures taken by the government to curb the spread of the COVID-19. As Rekiatu Njingi Musa reports in the following story that though the region has just recorded 3 cases already, preventive measures have been intensified to hold back a further spread of the virus in the region.
The Adamawa region is set to fight the COVID-19 pandemic as the coming of the Secretary of State in charge of epidemic and pandemics control at the Ministry of Public Health, Halim Hayatu, raises hopes to the inhabitants, perplexed by the presence of 3 suspected cases, accompanied by the Adamawa Governor Kildadi Tageke Bukar and other living forces of the region. Halim Hayatu visited the train station, one of the main entry points to the region, the hydroalcoholic production unit of the University of Ngaoundéré, with a daily production capacity of about 6,000 liters of hydroalcoholic gel.
I think now is very ready. I am very happy to hear this morning. I see all the seat accommodation in authority in Adamawa to this fight against COVID stuff. I congratulate the governor and congratulate population in Adamawa by this position.
To ensure the safety of patients, he visited different appropriate centers selected for the isolation of COVID-19 patients. Amongst them, the National Armed Forces Training Center, CFAN, Ngaoundéré Low-Cost Housing Facilities, the Epidemic Management Center of the Ngaoundéré Regional Hospital, and some volunteer hotels. The visit ended with a working session where Halim Hayatu praised the collective efforts of the media and living forces of the region in ongoing prevention campaigns against COVID-19 in the Adamawa. He equally recalled the government measures of compulsory mask wearing.
And the number of official confirmed COVID-19 cases in the northwest region has climbed to 5. They are being managed by the regional health authorities who have requisitioned 2 hotels to serve as quarantine centers. In a news briefing in Bamenda, the public health delegate, Dr. Kingsley Chenso, advised that people reduce interurban movements as much as possible and strictly respect all the hygiene protocols as outlined by the government. Winston Lebga tells us more from Bamenda.
News reporters are being informed that the confirmatory diagnosis for COVID-19 is now possible in Bamenda. And the 5 confirmed cases are said to be linked to Douala. 3 of them came into Bamenda from there. The 2 others are Bamenda residents who received visitors from Douala and then developed respiratory problems.
We are facing a pandemic for a highly contagious viral disease, and therefore movement of suspects should be condemned with the strongest terms.
Dr. Kingsley Chenso says the 5 confirmed cases in the Northwest are responding well to treatment, and the regional authorities have requisitioned 2 hotels to serve as quarantine centers. This is the delegate's advice to the people.
If anyone presents with fever, cough, running nostrils and shortness of breath, he or she should immediately call the toll-free number 1510, and he or she will be attended to in his or her city or village of residence.
The Rapid Intervention and Investigation Team of the Northwest Health Delegation has disinfected the homes of all the 5 patients and has conveyed 18 contacts to one of the quarantine sites for sample collection, testing, and confinement.
The chief of Bonadikombo village in Mile 4, Limbe, alongside youths of the area, have embarked on a sensitization campaign to educate the community on the existence of COVID-19 as well as on measures that government has taken to stop the spread of the disease. The chief of the area, Esombe David Maniwo, accompanied by the DO for Limbe 1, also donated hand-washing materials to the community while reminding them to respect government measures taken to curb the spread of the virus that has already taken lives in the seaside resort city of Limbe. Details with Giro Jenana.
Mile 4 being the main gateway into Limbe and Bonadikombo being at the entrance point of the town of Limbe, the youths of the area thought it wise to partner with the chief of Bonadikombo, Chief Esombe David Nanyowe, to build a block against the virus from this entrance point.
Main motor park in Mile 4 where vehicles bring people into Limbe, and here we are at the Wututu Park where vehicles that pass through Boya, pass through the Bojongo Road and enter Limbe. So he decided to block these 2 points. Anybody dropping here must wash their hands before entering main town Limbe.
The divisional officer for Limbe 1 equally took the opportunity to encourage the people of Limbe as a whole to be responsible in the midst of the virus.
For those who still seem not to believe that there is COVID-19 with us, to sit up.
Meanwhile, members of youth associations, partners to the sensitization campaign, also added their voices in raising awareness on the virus. It is hoped that in the days ahead, such campaigns will have tangible results in the fight against the coronavirus in Limbe.
Ecobank Douala has taken up the challenge to join in the collective fight against the coronavirus pandemic in Cameroon. The bank has donated a health care kit worth over 70 million CFA francs to the Douala Lakentene Hospital as part of this nationwide fight. We have details in this report with Bidnia Ata Tabara.
It is a groundbreaking gesture of Ecobank Cameroon in the face of the health crisis rocking the country. The package comprises 100 hospital beds, 30 buckets of hand sterilizers, 7 respiratory machines, 2,000 packets of surgical gloves and 20 gallons, 5 liters each of hand disinfectant, valued at over 70 million CFA francs. Officials of Ecobank Cameroon say their intervention in the fight is justified by the economic interest of the country, which they hold tight at heart.
We have to fight against COVID-19 while supporting the government. For us to have economic development, people have to be healthy. And in the front and the face of a pandemic like COVID, we have to join hands with the government, with the medical teams of the different hospitals to be able to come up with support to make this pandemic come to an end.
This humanitarian gesture by EcoBank Group transcends national borders and touches countries where the bank has been implanted on the continent.
Lakentini is the only hospital benefiting, because the aim was to look at the hospital that is receiving the most patients and give our support to that hospital.
The administration of Lakentini Hospital acknowledged that the equipment are invaluable in the health institution's technical capacity to contain the virus.
Nous allons avoir 7 places.
We will now have 7 new places for reanimation. Initially, we had 100 beds for COVID-19. Now it has risen to 200 beds. The new coming patients will be catered for with these equipment from EcoBank.
The donation by EcoBank is a symbol that saving money is good, but saving lives is better.
Thanks for watching the 7:30 news on the Cameroon Radio Television, the CRTV. We are beaming live from Yaoundé. Ahead of the tarring of the Ebolova-Akomtu-Kribi Highway, expected to begin in just a couple of months from today, maintenance works to facilitate circulation on the stretch have been scheduled for the days ahead. The company in charge of the works has announced that funding is already available, and promised authorities in Akomtu that local manpower will be utilized to carry out the project. Details with Pontianus Lawon.
An age-old desire of the people of the South region, the tarring of the Ebolova-Akomtu-Kribi Highway is imminent. A sigh of relief to the local population that has had to brave the bumpy and dusty stretch in the dry season, slippery and muddy in the rainy season. When it hasn't rained, it takes at least 3 hours from Ebolova to get to Kribi. When it rains, it takes at least 5 hours. The contract to construct the 190 kilometers highway has been awarded to an Italian firm, but while awaiting the start of works, its representatives in Cameroon have been charged with maintaining the road as the rainy season intensifies. We have, according to instructions from the Ministry of Public Works, subcontracted maintenance works which will last for 2 to 3 months. The local population has expressed the wish that the 36-month work duration be respected.
We just want to say thank you, Mr. President. We have seen people from Yaoundé, people from Italy in last week, and now those people are here in Akomdu for the beginning of the works of our road.
Representatives of the Italian firm have assured local administrative and municipal authorities that they will utilize available local manpower to deliver the goods and on time.
And in a related development, reconstruction officials of the Southwest Development Authority, SOWEDA, say they have the skills and the capacity to take on any assignments that will be handed over to them as far as the reconstruction of the region is concerned. The general manager was speaking to CRTV within the context of the president's reconstruction plan in a recent interview with CRTV Southwest reporters. More with Henry McCauley from CRTV Southwest in Buea.
The Southwest Development Authority, SOWEDA, has 2 things to its advantage. It was built to take on rural development challenges, and its officials equally took part in the national dialogue, which focused on what will be needed to reconstruct the Southwest region and how it will be done. So SOWEDA understands exactly what it means to reconstruct the Southwest region.
The mission of the establishment is for it to be a major catalyst in the rural development of our region. And if you look at it, therefore, most of the activities of the reconstruction program will be in the rural area.
Given that the reconstruction is vast, the people of the Southwest region may want to understand exactly the specific things that SOWEDA may be bringing to the physical reconstruction process.
The rural social infrastructures like water points and markets and so forth. We also hope that if the resources are available and we are given that responsibility, we will make our part Of course, you must have noticed that at the beginning of this planting season, Soweto has already put forth about 62 tons of maize seed free.
For the general manager of Soweto, Dr. Ogokuntui Bisong, his structure has the capacity and the skills. What it may need for now are the resources.
And there were shouts of free, free, free at last up in the air in Nkambe as 16 inmates of the Nkambe principal prison were released following the presidential decree commuting and remitting jail terms in the country. The Rasta Station of Freedom were handed over to them in an event chaired by the Senior Divisional Officer for Donga Mantung, Simon Quentinda, who called on them to avoid any criminal acts that could bring them back to the prison. We have details with Sylvie Banta in the following paper.
The total number of beneficiaries in Donga Mantum Division from the presidential clemency are 31 prisoners. So far, 16 of them have already received certificates attesting to their freedom, with the rest of them to be released in the days ahead. While appreciating the presidential gesture, one of them, who has been in prison for the past 13 years, says their stay in prison has transformed them into better persons.
Our sisters also, they stay with me here together. We don't be changed because we don't still be as we become where we be.
The Senior Divisional Officer from Nkambe cautioned the free prisoners to refrain from any criminal activity that can bring them back to jail.
We don't hear saying that 16 they qualify for go out. And 15 where they still there under the registry of Nkambe, they day elsewhere and they go benefit, bringing the total to 31.
Inmates of the Nkambe principal prison were also tested for signs of the coronavirus with no suspected case recorded.
The 7:30 news on the Cameroon Radio Television. That's the way it was this Monday evening. Thanks for the privilege of your company. Good night.